Rational Emotive Behavior Therapy and Counseling. Introduction. Rational Emotive Behavior Therapy, REBT, is based on the action-oriented approach to counseling. Its purpose is to identify self-defeating negative thoughts, determine irrational feelings and beliefs, and help the client address their behavioral and emotional issues. According to Gladding, Albert Ellis founded his theory of REBT in 1955, which began as a cognitive approach and now includes behavioral and emotional concepts. The core principle of this approach lies in the connection between the way people think, feel, and act. Ellis argued that a change in thinking patterns could reduce symptoms and improve the quality of life. This paper aims to provide an overview of rational emotive behavior therapy and discuss its key components, the role of the therapist, and counseling techniques that might be used with this approach. Key components of REBT. The theory of rational emotive behavior therapy is based on the assumption that people generally wish to succeed in their lives. In this regard, irrational feelings and thoughts can influence one's perception of various events and circumstances, which reduces the probability of achieving one's goals. The key components of rational emotive behavior therapy can be described using the ABC framework of human interaction. As Gladding explains, A signifies an activating experience, B represents how the person thinks about the experience, and C is the emotional reaction to B. This model can be applied to a particular problem to help the client reframe their perception of a situation. The first component is the activating event that can be defined as the adverse experience of a person, external or internal by nature. The second element is one's belief about the situation or problem. It can include rational and functional responses, such as self-acceptance, moderate tolerance, and preference. In turn, the person's belief can involve irrational and dysfunctional reactions, such as self-downing, lack of tolerance, or demandingness. The third component refers to the consequences of one's emotional or behavioral reaction, which can be adaptive or maladaptive. Overall, the ABC model of REBT can be used to facilitate tolerance in clients, help individuals accept themselves, think rationally, and achieve personal goals. The role of the therapist. Therapists aim to help clients reframe their thinking patterns to reduce irrational thoughts and improve functionality. As Gladding notes, counselors are active, direct, provocative, and confrontational in the REBT approach. They act as teaching-oriented instructors, as one of the main objectives of the therapy is to correct the person's cognitions. In this regard, logic, attention, and self-management are essential to achieving positive outcomes, and the role of the mental health professional is to identify and challenge the patient's faulty statements. Irrational thinking is considered one of the central concepts of rational emotive behavior therapy. As can be seen, this approach requires the therapist to actively participate in the therapeutic process, directing the client, unlike in other cognitive behavioral counseling methods, for instance, person-centered therapy. At the same time, counselors demonstrate care and concern as they attend to patients' behavior, recall personal details about their problems, ask questions, use appropriate humor, and demonstrate support for solving the issue. According to Gladding, REBT therapists should be bright, knowledgeable, empathetic, respectful, genuine, concrete, persistent, scientific, interested in helping others, and involved in using REBT themselves. The humanistic principle of unconditional self-acceptance is critical for this method of counseling. REBT techniques. Rational emotive behavior therapy techniques focus on the impact of adverse events and aim to reduce their emotional consequences for individuals. The ABC model can be utilized to identify one's beliefs and interpretations that cause psychological distress. As a result, the client can determine the possibilities for change in behavior and thinking. The first type of technique addresses the activating event and includes exercises to develop assertiveness and problem-solving, social, and decision-making skills. Furthermore, cognitive restructuring methods can be implemented to replace irrational thoughts with positive ones. The second group of techniques comprises cognitive and behavioral disputation, rational emotive imagery, REI, guided visualization, humor and irony, exposure to fear, reframing, and rationalizing approaches. Such methods address the client's irrational beliefs and appeal to logical reasoning. Finally, the third type of REBT practice includes coping methods to help the individual manage the emotional consequences of the activating event or situation. For instance, the therapist might recommend relaxation techniques, hypnosis, or meditation. Overall, rational emotive behavior therapy can include a variety of methods based on the client's symptoms and problems. Disputation and teaching should be considered the primary components of the therapeutic process. Conclusion. To summarize, rational emotive behavior therapy is a counseling approach that encourages patients to be tolerant and accept themselves rather than let irrational beliefs affect their lives. The counselor acts as an instructor to help the individual reduce self-defeating behavior, achieve personal goals, and reframe harmful thinking patterns. Various counseling techniques can be implemented by the therapist, such as disputation, the teaching of essential skills, rational emotive imagery, and rationalizing methods.